Hello and welcome to Moments in Medicine Live, hosted on Nebraska Medicine's Facebook page every week. I'm Christine Buhman, and today I am joined by orthopedic surgeon Dr. Katie Freeman. She's of our sports medicine program here at Nebraska Medicine. Today we're going to be talking about common soccer injuries and the things you can do to prevent them. So thanks for joining us today.
Thanks for having me.
Yeah. Let's just talk about where we're located today. We're down at the Bellevue Medical Center.
Yep.
New orthopedic office.
Yeah, absolutely. So we have been here for just under a year. We're in a different clinic location, but have moved into a nice new clinic space here in the medical office building at Bellevue, and have expanded our sports medicine program, so it's going well.
Yeah, that's awesome. And let's talk about a little bit about your personal history. You were a soccer player, both collegiate and high school, which is kind of what fueled your passion, right? To become an orthopedic surgeon?
Yep, absolutely. So played all different sports growing up, but certainly soccer was my favorite, and played that all growing up and in college. So I definitely have a sincere interest in this topic and really like taking care of soccer athletes and getting them back. So
yeah, that's great. Having someone that's been potentially in your shoes, athletes.
Yeah.
So, let's kind of jump in. What are some of the most common soccer injuries that you see?
Yeah, so some of the most common are things like ankle sprains, quadricep and hamstring strains. We see overuse injuries, things like shin splints, stress fractures, tendonitis, those type of things. And then the injury that kind of every soccer player dreads or wants to avoid is an ACL tear.
Sure.
Of course.
Okay. How do you know, when to come in and see you, right? When do you make that appointment when it's like, yeah, this might be more than just a pain that's lasting a week?
Yeah, so if you have a severe injury, meaning if you hear or feel a pop, you get a lot of swelling in a joint, you can't weight bear or put weight on that extremity, then I would certainly make an appointment with a physician for those type of things. If you've had a pain, like you were saying, for several days or a week, and it's just not getting better with rest, ice, compression, elevation, those type of things, then it's certainly worth making an appointment with a physician.
Sure. As you see, these injuries kind of come in, what do you think's making injuries more prevalent today than maybe years prior, or?
So I think part of it is just exposure. So soccer is growing very quickly in the United States. So, and as more athletes play, I think just by the increased exposure and increased opportunity for injury, I think that increases the chance of injuries. That combined with, I think players now are playing basically year round. So they're training and playing year round. And so they're just exposed to more opportunities for injuries.
Sure. Let's circle back on that dreaded ACL tear. Yeah. Are there things you can do to prevent tearing your ACL or anything?
Yeah, absolutely. So in the past several years, there's a lot of different programs that have been developed to reduce injuries in soccer players, and specifically ACL tears. So those programs are what we call dynamic warm-ups, but they're basically a combination of running, strengthening, plyometric, and balancing exercises that basically their purpose is to reduce injury. So players do that prior to practice and games, and if they're very consistent, it has been shown to reduce injuries, and especially ACL tears.
Very nice. What happens when you get the news that, yes, in fact, you tore your ACL? What's treatment like? What's the recovery?
Yeah, so if that athlete, desires to get back to their sport, which most of them do, then we do surgery, typically do surgery, which is a ACL reconstruction, but then it's a long recovery after that. So they're in physical therapy for several months, and it can be, anywhere from 8-9 months, even up to a year, to kind of get back to your sport.
Sure, and they kind of follow up with you through that?
Absolutely.
Treatment? Okay.
Yep.
Great. The other thing you mentioned was overuse injuries. What kind of classifies as an overuse injury?
Yeah, so overuse injuries are those symptoms or injuries that come about not necessarily because of one specific incident. So Typically that's due to overtraining. That can be an increase in time in training or an increase in intensity. It can even be due to if you change the way you train. So if you're used to training on grass or soft ground and you go to turf or hard surface, that can cause overuse injuries.
Very interesting. Is there anything you can do to prevent those, or?
Yeah, one of the big things is to not overtrain. And so there's a fine line that athletes kind of walk where you have to train enough to get better and you want to get better, but you don't want to overtrain and cause those injuries. So, letting your body rest, having adequate nutrition, adequate hydration, all of those things can help prevent overuse injuries.
Interesting, thanks. As far as like athletes go, male versus female, are there differences in, the types of injuries that you see in males or females?
Yeah, there are. So kind of going back to the ACL tears, ACL tears are common in both male and female soccer athletes, but we do see a higher incidence in female athletes. In females, we also see or tend to see more kind of ankle sprains or different knee ligament injuries, whereas in male soccer athletes, we see more contusions, fractures, hamstring and groin injuries.
Okay, what causes kind of the difference between the two?
Yeah, if we take ACL tears, for example, so a lot of research has been done on that, and there tends to be a thought that some anatomical differences and hormonal differences can be a reason that females get more ACL tears, and obviously we can't modify those, but another reason is what we call neuromuscular movement. So basically the way females tend to move is when they jump and land or when they turn and pivot, their knee kind of collapses in, and that motion can cause a really high chance or put a lot of strain on the ACL and risk for ACL tear.
Okay. Are there any other things that would maybe increase your risk of obtaining one of these injuries?
Potentially overtraining as well. So if they overtrain and are fatigued and they continue to try to play, that can certainly increase your chance for injury.
Okay. And kind of curious, what differentiates the treatment that you provide and the orthopedic department at Nebraska Medicine?
Yeah, so I think the sports medicine department at Nebraska Medicine is unique because we provide comprehensive care. And so what I mean by that is we have orthopedic surgeons, non-operative sports medicine surgeons, athletic trainers, as well as sports medicine physical therapists that kind of all come together to treat these athletes. And so I think that really kind of sets us apart.
An entire comprehensive treatment plan, all located right here. That's nice. What piece of advice would you recommend to the many soccer parents out there, or even multi-sport athletes? What one piece of advice could you give, to them to prevent injury or to see? Yeah,
I think one thing is just listen to your body. So, they do need rest, they need good nutrition, they need adequate hydration. And so, although a lot of these athletes train year round, they do need an adequate rest in order to prevent injury. And that can be, a lot of times I encourage these soccer athletes to play a different sport or get involved in a different activity, because that way they're not necessarily focusing all their training on one area of the body, and can hopefully prevent injury as well.
Sure. Well, that is great advice. And that's actually all of the questions that we have for today. So I want to thank you again for joining us.
Oh, thanks for having me.
It's been nice to chat with you. And as a note, if you would like to see Dr. Freeman or need to find a Nebraska Medicine clinic near you, just go ahead and call 800-922-0000 or visit us online at nebraskamed.com.